Dr. Baker here. Hey, so recently I saw a post from a 5-year carnivore who has not only high coronary artery calcium, but increasingly high coronary artery calcium. In fact, when he started carnivore, his calcium score was about 1,400, and now 5 years later, it's 5,600. So, nearly a quadrupling of his calcium has been seen in his vessels. And obviously he's concerned about that, and as he should be, I think so. And but I want to explain something to you guys on how to think about calcium scores. And so, there's a big difference between a 0 score and some other number, right? And that's a very important distinction. A lot of times we hear people, long-term ketogenic diets, carnivore diets, they'll say, I have a 0 score. I've been doing a carnivore diet for 5 years, 10 years, keto diet, 10, 15, 20 years. I'm 70 years old and I have a 0 score. That is generally accepted as a good thing, right? Now, it could mean there's a little bit of uncalcified plaque that has occurred that we haven't detected yet. But in general, most people with a 0 calcium score will have a small amount to none of the uncalcified calcium or plaque. Now, it's possible that there's some people who could have significant plaque despite a 0 score. That tends to be uncommon or relatively uncommon, especially in asymptomatic people. But let's talk more about this particular situation where he had calcium in his vessels. Now, I'm going to use a few props here to kind of explain some concepts to you guys. So there is a concept of the coronary artery calcium score, which depends upon the volume of material that is plaque that's been calcified, and then how dense the calcification is. So let me show you an example here. So let's pretend this cup is a blood vessel, and when we put water in it, so now we're adding plaque. So this is soft plaque. So now we have a blood vessel full of soft plaque. And so I'm going to got some salt here. You can use whatever salt you want for this experiment. It's going to pretend it's calcium, right? So if I add a tablespoon of salt to this water, so we'll pretend that's calcium going into the blood vessel, right? We mix it up. And so now this container has a density to it, right? And so when I shoot an X-ray through it, it's going to have some particles that block those X-ray beams. We call that radio density, and that's measured in something called the Hounsfield unit. And the Hounsfield units can range from air being the least radio dense, a -1,000 score, up to bone, which has a score of roughly 3,000. Water is arbitrarily set as 0. So now, before this was water, and if we ignore the glass, the water would have had a score of 0. We've added some quote-unquote calcium, and so that score is now gone up. So now we have some score. So let's say in this particular instance, this score is now 100. So we've got a calcium score of 100, one blood vessel. Now, we can increase that over time, right? So let's see what happens. Let's see, there's two things that we could do to increase it over time. One is, all of a sudden we could get a second blood vessel, more plaque being filled up, and we could add one more scoop of our calcium. Okay, mix it up. So now our score has doubled. It is 200, right? This is a 200 score. We've got more volume, and our score is 200. There's an alternative thing that can happen. So check this out. Let's say we went back to our original situation. We have 100. And now we're just going to keep the same amount of volume, but we're going to add another scoop of salt in there, another scoop of calcium. So now this score is also 200, right? So we have two situations where we have 200. Let's pretend this is back at 100. So now we have two vessels with 200. Actually, I'll make another one. Let me do that. So for the ease of illustration, I'll do this. So we're going to fill up another glass. We're going to put one scoop in there. Okay. So now we have two scenarios. This one has 2 scoops in it, scores 200. Each of these has 1 scoop of it, score of 200. Both of these situations score 200 on the Agatston score, all right? Which is worse, all right? Well, this is far worse. In fact, this situation This situation here might even be better than this situation, where this score is 100, this score is 200, because there's more density here, right? And this is one of the limitations of the calcium score. It's really good when you go from 0 to something. That clearly shows an increase in risk. But when you have a higher number, let's say the number is 1,000, increases in calcium may not represent a significant increase in cardiovascular risk. And in fact, in some cases, it can actually represent a decrease in risk. Why is that? Because we know that increased calcium density actually has been associated with actual decreased risk overall. Now, so that's a sort of a counterintuitive sort of scenario. When you think about that, well, my calcium scores got up, clearly I have more heart disease. Only in the situation where you have more plaque, typically. Now, what does the calcification represent? An increase in calcification represents one of the biggest correlates is just age. Over time, you're going to put down more calcium. That is considered kind of normal part of aging. It's also, interestingly enough, associated with several things that associate increasing density. One of those things is to be athletic, to exercise. Exercising actually increases the density of calcium. And we know that there's studies on athletes, masters athletes, where they have, let's say two people, one has a really high score, say 500, and another person has a high score, say 500. The athlete's outcomes will almost always be better with regard to cardiovascular outcomes and events. Less heart attacks, less strokes, even though they have the same score. And that's because the thought is it is a more density phenomenon rather than a volume phenomenon. And so other things that increase density, we mentioned age, athletic ability. We know that, for instance, low blood pressure increases density. We know that lack of diabetes increases density. We know that, for instance, low BMI increases density. So these traditionally good risk factors, high HDL increases density. So depending upon how that calcium is deposited, is it being more volume, more blood vessel being involved, more surface area and blood vessel being covered, that is clearly a greater risk than is greater density by itself. So knowing the difference between density and volume is an important aspect of this. And this is something, the Agatson's formulas come up something like back in 1990 by Dr. Agatston. Since that time, he kind of arbitrarily assigned density on Hounsfield units, 130 to 200 gave a 1 score, 200 to 300 gave you a 2 score, 300 to 400 gave you a 3 score, and then anything above 400 gave you just a 4 score, right? So you would have these different multipliers. So if everything's low, the density could increase. Now, interestingly, those scores can go way above 400. They go well above 1,000. And so if for instance, this fellow Keto5 had, radio densities in the 5, Hounsfield units in the 1,000 plus, that may be why his numbers has gone up significantly, and it hasn't dramatically increased his overall risk. Now, that's obviously speculative on my part, but it's certainly, we know that does occur, and we know some of the reasons for that. Now, the smart thing to do, and I think he's going to be doing, is going to get CT angiography so he can assess, the full level of plaque, soft plaque, hard plaque, so on and so forth, and see where his risk is. Now, I don't know if he has a comparison previous one. That would be nice to know. One other thing that could be done is try to calculate the density scores. If those weren't previously reported, they probably could be calculated, I suspect. I'm not a radiologist. I don't know the answer to that, but I suspect if you go back and you look at the software imaging, you could probably get the Hounsfield units and then calculate a radiodensity score, which will give you some value. So if all of that change was due to density, his overall risk might have actually gone down, believe it or not, even though his score went from 1,400 to 5,600. Now, if it was mostly volume-based, then in that situation, that is clearly increasing atherosclerotic disease. That is clearly increasing risk for the negative effects, heart attacks, strokes, and so on and so forth. And then what you do with that is obviously between him and his physician. Now, options could be go off the carnivore diet. Perhaps it could be lower your lipid levels. I don't know if he has high cholesterol. I suspect probably he does, given that he is lean on a low-carb diet, which we know, as I've mentioned in many other videos, the driving phenomenon for high cholesterol and low carb is often leanness, right? Athletic, being lean, active, fit can often drive that up. So if, for instance, the CT angiography shows that he's asymptomatic, he has no chest pain, no detriments in his cardiac output, then perhaps watchful waiting is still warranted. Now, again, some people would argue for, depending on what the lesions are, whether you stent it or not. That's also controversial. A lot of the reflex, put a stent in, has now been shown that often doesn't help. It's often not helpful at all. So it's an interesting scenario, but there's nuance here, guys. Just like most things, we can't just hang our hats on, my calcium score went up. That's definitely bad. It may or may not be. Now it could be, and it very likely could be. Don't know the details here, but just something to understand. The coronary artery calcium score is dependent not only on just the density, but also the volume of the plaque involved, and it's the higher volume and not so much the density, which is the more worrisome component. Hopefully that helps. Let me know if you have any questions. Again, there's even more nuance behind it. You can talk about peak density and average density. And there's a lot of stuff that goes into this, and the size of the person and the units, the software they're running. There's a lot of things that go into this. It's not as simple and straightforward as we're sort of told it is. Like everything, everything has more nuance and complication. But anyway, Keto5, I hope you get to the bottom of this. I wish you well. I know you've went on carnivore and it's dramatically improved your quality of life, which is awesome. And thanks for bringing this to the attention, because this is a good opportunity for a little bit of a teaching point and some learning on my part, because I did a little investigation to understand this a little bit better. And like I said, a lot of nuance here. All right, guys, talk to you soon.